issues here in terms of functional medicine or preventive cardiology, or just briefly just knowing what is missed and what we need to pay attention to. So why do we need to look at cardiology as the preventive cardiology or a different way of looking is because of the causes of death has still now eventually replacing by cancer, but always have been a cardiac has been a significant disease that we need to think of prevention, because it's always an acute care we manage about. But preventive cardiology in terms of in as GPs is absolutely needed, and general physicians needs to think about preventive cardiology as a regular practice of medicine. So that's why, because we can prevent these diseases. So as we are here, we are talking about all these. Heart disease, which is 85% preventable. And how we can prevent it is as much as 5 minutes, I'm just going to go through this. So just by looking at this one slide, okay, this is when the time, we were still, practicing physicians, like the senior physicians are there, and that's the Time magazine which is selling about cholesterol, and 2014, again saying butter is good. So, oops, sorry, the word, we did something wrong. Are we, to get this one slide, explain it all. Again, we thought overweight, non-fit, heavy smoker are the people for cardiac issues. But today, not overweight, very fit, non-smoking people are also having cardiac issues. That is why we all need to think about preventive and preventive cardiology. So routine labs are not adequate. The LDL levels, which we have been bombarding with coronary artery disease, it is absolutely not adequate, because as 77% people have normal LDL. So action, the first step is getting tested for inflammation. So why cardiology is important? Because inflammation is the factor behind the atherosclerosis. And what is the inflammation is what we are going to take about. So we have 17 markers in artery diseases. It's not the LDL alone. It is not the cholesterol panel alone. You have to check 17 parameters in your cardiology prevention. And this is one slide if you want to check, and everything is available in India. Maybe 1 or 2 markers are not available in India, but this is what we are checking in US of 30-year-old or 40 or 50-year-old of prevention of 17 markers. And the heart and the gut. If the second issue that you want to talk about the heart, it's still the gut. It's still the gut dysbiosis and the still gut microbiome. In one slide, I'll tell you how it's closely related to the gut microbiome. Again, we have something called cardiovascular inflammation tests. If you can test these of total cholesterol, you already know the triglycerides and non-HDL and apolipo-B, lipoprotein little a it's called, and lipid ratio. So there are 2 markers that we have to test, and it is available in your diagnostics in India. It's called lipoprotein little a and apolipoprotein B. Again, why? It is sticky. What is sticking? This is what is sticking, and it's glue which is stick together, causing blood clots, and that is blocking arteries. So elevated lipoprotein little a affects 25% of the population. So test everybody. And apolipo-B is a single best cholesterol predictor of risk for heart attack and stroke. And every particle of dangerous cholesterol is wrapped up by an ApoB. So this is a new data which we need to look at and that. And part of the CIT panel is called cardiovascular inflammatory panel, test panel, HSCRP, glucose, HbA1c, and homocysteine with lipoprotein little a and as like ApoB. So these are all you're including in your cardiometabolic inflammatory tests. Again, infection. So there is a smaller chunk of infection. When you talk about infection, dentistry come into place, how oral microbiome and how oral treatments is come into cardiology, and then lipopolysaccharides also come into place. So you have to think of an infection also if you have an acute or a chronic condition, because you have chronic fungal infections called candidias and all kind of Epstein-Barr virus and herpes. These are all that we are testing for every preventive cardiology as well. So just a simple thing, how infection can be related to cardiology in terms of inflammation. There is exotoxin and endotoxin. We need to understand what is an endotoxin. Endotoxin is nothing but it's a lipopolysaccharide, part of outer membrane. It's not a toxoid, and it is part of, its specificity is low degree and there is no enzymatic activity. Whereas exotoxin has a toxoid activity. The lipopolysaccharides is what the current data is booming, and we are having more information on cardiology. So if you talk about gut dysbiosis and gut microbiodata, the gut microbiodata is infection, metabolism, diet, and microbial metabolites. As the first speaker in that time is Dr. Sunita was saying about diet. Now, how do we physicians have to talk about diet? Why? Because of the inflammatory markers of what kind of diet is generating. So this slide is very, very important about diet, and what is the wrong diet is going to produce inflammatory markers. So the nutritionists have to know, when you're saying carbohydrate, when you're saying fiber, when you're saying protein, it is important for us to go in the mind of what is going on in the gut while we are talking to them about diet or nutrition. So this is the one thing that dietary fiber, choline, your protein diet, your lipid diet, and your invasive bacteria. So this is what? Glucose metabolism, lipid metabolism, and protein metabolism. So you have to know what is going on with the carbohydrate when you're talking about carbohydrate diet. So lipid as well as protein. What is that wrong thing about protein which is happening as an inflammatory marker? So this is what happens. In gut, what happens? Bacterial overgrowth, impaired host defense, and altered gut barrier function. So if you understand this, how a bacterial endotoxin enters the bloodstream and causes inflammation. So the endotoxin, so there's a very fine difference of positive and negative feedback mechanism here, because gut permeability as well as lipopolysaccharide. So as much as you have small chain fatty acids, which is producing those acetate and butyrate, and it causes decreased inflammation. But when you're talking about undigested fiber, which is causing wrong microbiome, it causes lipopolysaccharides. So there is a fine difference between this gut as well as heart, atherosclerosis, and cardiovascular disease, whereas gut-derived low-grade endotoxemia, it is not fever-induced infections. It is low-grade endotoxemia, which is related to the cardiovascular diseases. So healthy gut, LPGs and TMOs, this is what we are testing now as preventive cardiology, called trimethyl amino oxide, called TMOs, which is causing oxidative stress in cardiovascular. So this is the lipopolysaccharide mediated thrombosis. So lipopolysaccharide mediated thrombosis, which causes monocytes, neutrophils, platelets, and how endothelial dysfunction is causing. So gut microbiota will produce such as bile acids and TMOs and lipopolysaccharides and short chain fatty acids. This is very, very important in terms of host metabolism influencing both health and disease working in the body. So this is where exactly with your small chain fatty acids will inhibit the inflammation, whereas the TMOs which stimulates the inflammation. So this is one slide which we said when you're talking about carbohydrate, protein, and diet, and microbiota. All these microbiome and gut-related metabolites which causes chronic diseases, including cardiovascular. So you have to know gut microbiome as well as gut-derived metabolites. It's all about what the microbiome is secreting, which is circulating, causing infection, inflammation, or a healthiness. So it is all about a metabolites that the microbiomes are secreting, which is acetate, butyrate, and pyranate. But if you have an LPS and lipopolysaccharide, you will be stimulating the inflammation. So short chain fatty acids are a friend or a foe. So gut microbiome ferment indigested dietary fiber to generate the small chain fatty acids. Mainly acetate, butyrate, and small chain fatty acids are good, but how do they form? Because of the gut microbiome. So the gut microbiome, due to their anti-inflammatory properties, short chain fatty acids have a highly beneficial, including chronic disease to neurodegenerative disease, obesity, diabetes, immunologically, and everything. Another protein. So any kind of protein diet which is called TMOs, high plasma TMOs which causes endothelial dysfunction, atherosclerosis, acute heart failure, and inflammation. Heavy metals we already talked about. So this is what a HSCRP and microglobulin is about. Again, detection. Now this is what we are saying as carotid intima media thickness. I don't know how many people do it here. but as a preventive model, it is avoided. Carotid intima media thickness is very, very important. So this is one screen where you are having diagnostic panel, the risk factor as well as invasive testing called calcium score. I see a lot of, in Hyderabad, where many people are doing calcium score. But nobody is, I don't think, they're checking the intima level and all. They are not checking. So that's why intima media thickness became part of procedures as a clinic. I am a clinic, we are not a hospitalist. I am a clinician which is in a clinic. These are the parameters which can do in our clinics as a preventive management, and this is what we are doing in vessel wall thickness correlates with the cardiovascular events. And this is what we are doing, and this is my clinic picture, which is showing that 0.60 mm is generally considered healthy if you want to take out, and that is a silent plug that you are doing. Now what did we do? This is what we did in our clinic called 7R action plan. Reset, diet, lifestyle, mindset, as we talked about, remove unwanted pathogens, replace digestive enzymes and stomach acid, regenerate damaged intestinal mucosa, re-inoculate pre and probiotics, reintroduce certain foods which are removed, and retain your gut integrity. Again, diet, calorie restriction and fasting. Okay, this is what is better before and after. So this is what metabolites, inflammatory markers and advanced lipid testing. And this is one of my patient, this is, we tested these gut barrier panels, and these are our panels in our clinic there, calling direct triglycerides, again inflammatory oxidative stress and all that. So this is what we did in our protocol, modified HR with lipid protocol. This is the treatment we did as well as before, and this is the after. All that became negative, and this is what we said, again Candida, Zolinine, Oculin, LPS. We test these in our labs. Again, these are the results which before and after with this treatment. So again, they became negative after 180 days of these. These are the 3 panels that I picked up, and this is the plug which has a reversible in terms of from 3.3 mm to 1.8. Thank you so much.
Thanks, Sudha. I think you have done a fabulous work. Dr. Sudha Speaker deserves a kind of thing. Just have an applause. Dr. Saxena is a dermatologist of repute in Hyderabad. Right? Certainly, it was great to see you. Photo here. Go on. Thank you, Sudha. And thanks, Dr. Meena. And again, ये सज्जन है सब सज्जन है नेम सज्जन है थैंक यू डॉक्टर दिगंबर सर he came from US a week back and he said we are going to come जब बोला था हमारे मित्र हैं पड़ोसी हैं डॉक्टर सिबिया सर Thank you, Sajid. Thank you. So we will just go for the next panel, and you people are going to wait, sir, because you have to still. Last session will be there. Yeah. So fine. I invite Sanjeev Sharma ji, and Sanjeev Sharma requires an introduction. But I can tell you this: Dr. Sanjeev Sharma is one guy who I met, and he's always have that kind of smile. Shayad you could have been a Bollywood actor also. Such a magnificent. Please welcome, sir. Please come. Please come. He's going to talk. Dr. Artimida, Dr. Artimida. Both of them, they have a common thing. Both of them are psychiatrists, but they think differently. They are integrative psychiatrists. They don't believe in that labels or trying to give some psychotropic drugs and all that. Welcome, doctor. And the third one is, Dr. Sunita, please. Sunita Banerjee from Mumbai. Sunita Banerjee has, I know her since quite long, but somewhere she has done some excellent kind of work in anti-aging, bioidentical hormones and all that. And she's going to present something on a case study what we have decided on, and let us see what she has you started with AFM Sina. She was an Armed Forces Medical College graduate, and after that,
1983.
okay, 1983, I didn't got MBBS seat also that time. I joined in that. Fine, but whatever is it, she ventured into OBGYN. After that, she went into something like anti-aging. This one's a big kind of thing. We can always have a one-day discussion about that. So we'll start with Sanjeev Sharma first, right? Sanjeev, it's all yours.
Thank you, Praveenji, for a nice discussion and also the honor to give me a chance to speak with all of you. Now, Hyderabad is now becoming my second home, and this is because of my